Hey everybody, it's Dr. Brace here and it's Facial Plastics Friday. Welcome, and today we're going to talk about rhinoplasty and septorhinoplasty. So it's a common question I get, what is the difference? And really to understand the difference, you just have to understand the roots of the words. So rhino is from the Greek for nose, and plasty is from the Greek for to reshape or to mold. And so a rhinoplasty is basically to change the shape of your nose. That is a cosmetic procedure. A septorhinoplasty is to reshape your nose on the outside and the inside. The septum is the middle wall that runs right up and down your nose. It's cartilage in the front and bone in the back, and it can be deviated or twisted and cause breathing troubles. So if we are doing surgery to go inside the nose, straighten the septum, and improve the breathing, that is usually either a septoplasty or a septorhinoplasty. It's a septorhinoplasty if we're using grafts to help support the nose so that it doesn't collapse when you breathe, or if we're changing the shape of your nose at the same time as changing the function on the inside. So a follow-up question is often, what's covered by insurance? What is covered by OHIP? And the answer to that is really breathing. If you have trouble breathing through your nose, and that's your main concern, then OHIP will cover a septorhinoplasty if your surgeon writes a pre-approval form and asks for permission. It's never covered right away. You have to seek approval. And so they will cover the cases where you've had trauma to your nose or have a defect, a congenital defect that caused a twist in your nose or something that helps or prevents you from breathing well. So they'll pay to have your nose breathe better. OHIP will not cover changing the shape of your nose for it to look better. The only time they will is if it was a trauma and you've sought medical attention within 2 years of the nasal trauma. So if you have a bad car accident, you get smashed in the face, your nose is twisted and you can't breathe well, that's covered under OHIP to straighten your nose and help you breathe better. But only if you do it within 2 years of, or seek attention, medical attention within 2 years of the injury. If you had an accident 15 years ago and decide you don't like the way your nose looks, that's cosmetic. And so there are cases where we do combined cosmetic and insured septorhinoplasties. That is rare. Usually the person has a primary reason why they want to have surgery. It's either I really don't like the way my nose looks, and by the way, I can't breathe well. Well, in that case, that is a cosmetic surgery, and we reshape the nose and we make the breathing as good as possible. Form and function are interrelated, and so if you improve somebody's form and function, they'll have a nicer looking nose in most cases. So as a facial plastic surgeon, I'm never going to leave a deviated septum in somebody who wants a cosmetic rhinoplasty. We're going to make everything look and work as good as possible. If the primary concern is, doctor, I can't breathe through my nose, it's really terrible, and there are things that we can change through a septorhinoplasty to make it function better, then that's covered by OHIP in most cases if they will approve it, and that requires writing a pre-approval form. Your doctor, your surgeon has to do that. And so I hope that clears things up. The other factor to this is if OHIP is covering part of the surgery and you want cosmetic changes, then every surgeon's practice will be different. But for me, that means we have to do it at the hospital. And if we're doing an OHIP insured surgery at the hospital, that means you don't have control over when it's booked. It's basically in the wait list for surgery. And so that could be 2 years from now. If somebody wants to have surgery with cosmetic changes and improve their breathing and wants control of when they do it, well, we can do a cosmetic surgery and make their nose breathe better, and that would be done at a private center where they can choose when they want to have the surgery. So I hope that clears it up for everybody. A septorhinoplasty, make you breathe better and make your nose look better. A rhinoplasty is just make your nose look better. A septorhinoplasty can be cosmetic, functional, or both. So send us your rhinoplasty questions, and everybody have a safe weekend. Bye-bye.